So today for our public and preventative health discussion, I will be talking about stretch and strength training to improve endurance and postural ergonomics. Unfortunately, we are sure all these positions may seem familiar. A lot of us may start off with good posture in the beginning of a workday, but after long periods of time, we tend to get a little lazy and lose correct posture. And it's nice to point out this bottom right picture, just detailing compression when you sit at your desk hunched over for long, extended periods of time. So what are we talking about? In this presentation, we will address the importance of corrected posture, proper positioning of equipment, and as well as how stretching and strength training can decrease chronic neck and back pain and positively impact your overall health. Our target population is focused on groups of individuals that sit at a desk for long periods of time, and this is just a small list of examples of jobs that are sedentary. This includes, but is not limited to, students, receptionists, IT workers, bankers, remote workers. You kind of get the big picture, all jobs that are relatively sedentary. So our plan of execution is to educate the target population by going into offices, schools, etc., and basically explain the importance of correct posture, proper positioning of equipment, and stretches and exercises to address postural musculature. Our primary goal on the individual level would be to begin by educating individuals about the importance of posture and spinal health. Secondarily, we would further their education by teaching them stretches and strength exercises in order to minimize damage caused by poor posture. And lastly, providing an encouraging environment to get people to perform their stretches and strength exercises would be very beneficial in minimizing disability caused by poor posture and muscle weakness. Looking at community level, for the primary goal, we want to encourage companies to provide adequate office equipment to encourage correct posture and promote spine health. Secondarily, we want to spread the education on proper spinal position and health to the public and other companies in the community. And lastly, for tertiary, we want to encourage people to continue the stretches and strength exercises on a daily basis, making spinal health a priority in their daily routine. Lastly, looking at the overall system goals, for primary, we recommend chiropractic evaluations once every 6 months in order to learn and understand current spinal conditions. Secondarily, we would like to implement a policy for free annual posture evaluation. And lastly, having the rehab, stretching, and exercises included in all of the insurance plan cost. So one of our go-to relief exercises is Brugger's relief stretch, and it's a common tool we may use to reset our posture. Most of us do it without even realizing it. As you can see, it's a fairly simple concept. To consciously go through this stretch, begin by moving your bottom leg towards the edge of your chair and place your feet flat on the floor. Next, with your palms facing forward, extend your arms to your side, bring your shoulders back and down, press your chest up, and retract your chin into a neutral position. Hold this for 2 to 3 seconds for roughly 8 to 10 reps and repeat every 2 to 4 hours or as needed. So if you're sitting there, maybe it's only been an hour or 30 minutes and you're beginning to experience and develop that pain again, this is a quick and easy relief position to go to help. Neck range of motion stretches are a great way to alleviate tight neck muscles. The 6 ranges of motion include flexion, as you can see on the top left, extension, left and right lateral flexion, and left and right rotation. Position yourself in these different ranges of motion and hold for 30 seconds in each position and repeat for 2 repetitions. Repeat every 2 to 4 hours or as needed. By stretching the muscles in your neck, you can potentially prevent tension headaches as well as neck and shoulder tightness that is a result of poor posture and positioning of office equipment. Similar to the neck range of motion stretches, thoracic range of motion stretches are a great way to alleviate tightness and tension of the mid-back. The 6 ranges of motion include flexion, extension, left and right lateral flexion, and left and right rotation. Position yourself in these different ranges of motion and hold for 30 seconds in each position and repeat for 2 repetitions. Repeat every 2 to 4 hours or as needed, like the previous exercises. Chin retractions or chin tucks are great for stretching out the scalene muscle group on the front side of your neck and the suboccipital muscles at the base of the skull. They are also beneficial for strengthening the lower cervical neck extensors as well as the deep head flexors in the upper cervical region. This motion works to counter poor posture and anterior head carriage. To perform this exercise, use 2 fingers to tuck your chin back as far as possible while keeping your back and neck straight neutral. Hold this for 2 to 3 seconds for roughly 8 to 10 reps and repeat every 2 to 4 hours as needed. Scapular retractions are very beneficial for correcting posture. This exercise allows you to activate and strengthen your back muscles and help to counter rounding of the shoulders and slouching that commonly comes with poor posture. To perform this exercise, think about squeezing your shoulder blades together and imagine trying to hold a pencil between them. Hold this for 2 to 3 seconds for roughly 8 to 10 reps and repeat every 2 to 4 hours or as needed. Extensive hours of sitting can oftentimes lead to low back pain. This can be due to a number of reasons, but one of the most common is poor lower spine posture while sitting. In order to engage a pelvic tilt, flex your abdomen like you're trying to pull your belly button to your spine and while trying to straighten out your lower back. This is something that should constantly be engaged when sitting. To ease into this position, try doing 10 to 20 repetitions of these pelvic tilts and hold in the contracted phase for 5 seconds between each repetition. Repeat every 2 to 4 hours or as needed. Poor positioning of your desk equipment will lead to poor posture. Obviously, when your equipment is placed improperly, your body position will change based on your equipment in order to make things as easy as possible on itself. Some adjustments that may be easy to make may include placing padding in front of the keyboard, getting a mouse pad or with wrist support, raising or lowering your chair so your monitor can be directly in front of your eyes, or using a hands-free headset if you're on the phone often during the day. The social cognitive theory describes the influence of individual experiences, the actions of others, and environmental factors on individual health behaviors. Our treatment follows this theory by looking at individual differences in posture and office ergonomics and how the work environment, long work days promote gradual decrease in proper posture at a desk. So with all this, there will be challenges faced. So there are many challenges when attempting to correct posture changes, such as adherence to exercises, the availability of adequate desks and chairs, the ability to measure postural improvement, and the individual's health history. The conscious thought of participating in exercises to their full extent may seem daunting or easy to forget throughout the day and tends to present as a major issue when plans fail. The lack of availability of ergonomic chairs and desks may lead to complications such as increased symptoms or increased difficulty in maintaining correct posture. In order to see positive progression for improving symptoms and improving posture, there must be a baseline or progressive measurement and patient history performed. This may be difficult to obtain patient permission as it takes time and can be intrusive. An individual's health history may present difficulty in partaking in exercises if they have structural limitations or have congenital poor posture. For our evaluation process, first we would do a self-guided questionnaire. This is a subjective measurement, but it allows us to understand what the patient is thinking and how they are feeling. Next, we would measure range of motion and look for potential restrictions. This step helps us to locate the specific site of limitation and suggest proper stretches and exercises to combat their pain and discomfort. Lastly, we would evaluate their posture, and this will allow us to help make the corrective changes to their posture and prevent future pain or discomfort. There are small adjustments that could be made in order to not only significantly improve your posture, but to decrease in discomfort that may be a result of poor posture. These small adjustments only take a small amount of time from your day and could provide you with great results in reducing discomfort and mitigating long-term effects from poor posture and postural muscle weakness.